Good morning. While I was working out this morning, I heard that 3 million New Jerseyans have been vaccinated with either first or second dose. And we have achieved another milestone at Inspira. We've now vaccinated 50,000 people within our communities. I also wanted to tell you that we are changing our vaccination times. I've included those on the screen for you to be able to see. We have had to adjust based upon the people who are eligible. So we were doing more in the morning when we were focused on getting the 75-year-olds in, and now we have to move to teachers and others who need to come after work, and so we're trying to accommodate there as well. We will continue to shift and move as we can in reference to trying to accommodate you. Obviously, the most important thing is that we get vaccine. The state has been very deliberate about trying to spread the vaccine to other places, so I do encourage you to look for your local pharmacies. And again, many communities and governments are making available assistance to try and schedule those appointments. So I would encourage you to check with your local governments, as well as here is the number that the state uses to make sure that they can help people vaccinate as well. My understanding is they're still focused on those people who are over 75. So if you have yourself or loved ones in that category, please make sure you call this number to assist them in fulfilling that. You know, these have been such stressful times, and people have, we've seen, been very deliberate about what they come to healthcare for. And we see, as I've mentioned before, and I want to mention again, we've seen some of our screening programs really take a dip in reference to the number of people screened for cancer. It is so very important that people continue those regular screenings, whether it's mammograms or colorectal screenings, making sure that we have the opportunity to really catch this terrible disease early. We have availability, and we encourage you to really take the time to contact your doctor, see what screenings you're due for, and make sure we can help get you into those. You know, as we talk about the joy that comes from the vaccine, some of it is in that moment of elation when people get their second dose, but then there are others who come and share their stories. One of those is Jackie Kievit, one of our own employees who works in behavioral health. She had her 2 doses, and then her husband and daughter ended up contracting COVID. And she was so thankful that she could care for them, knowing that she had that protection of that second dose, and that she was able to do that freely. Now, she did it wisely, though. She made sure she washed her hands, she made sure she remained masked, she made sure she did all of the preventions, because we know that we have seen cases that have now arisen that the second doses don't necessarily prevent COVID. While the details are still coming, we know there's been a case in Illinois. We know that we're watching some cases here. The second variant is here from not only the UK, but we believe it's here from South Africa as well. So we have to stay vigilant. We must continue to make good decisions. You know, remain socially distanced, remain masked, wash those hands, and as much as possible, stay within your bubble. It is critically important to do. You know, the headline read this weekend that New Jersey has the highest rate of hospitalization in the country. That tells us this isn't over. 3 million people is a great start, but we've got more work to do. So as you know, through all of this, we want to continue to support our community and our staff. And so we have set up a community town hall, Managing Your Stress During COVID, for the 26th of March. We are putting our behavioral health experts back together and really trying to talk about some of the unique programs that have been established and some very important benefits that we all can use about how we manage our stress. And so I would encourage, for those of you who need information or need additional information, please reach out to our website. We do provide a lot of new information there, and continue to look for town halls that we may be offering. Again, I just want to thank you. Thank you for your patience, thank you for your time, and thank you for your commitment to allow us to partner with you to provide health care for you and your family. Until we meet again, be well and stay safe.